Okay. Next, I will talk about the slum test. Alright. First of all, okay, we move to the anatomy of the slum test. Alright. The slum test is a neural tension used to detect neurodynamic or neural tissue sensitivity. Alright. The patient may experience stretching, pain, or other neurological sensation in the area adhesions. Alright. Another use for the test is detecting lumbar disorientation. Alright. The test is used to detect the lumbar disorientation, okay, with the flat lumbar spine and the hip completely stimulously with extended. Okay, the sciatic nerve and its respective nerve roots are put on tension, right, to detect the potential of disorientation, right. So that's for the anatomy of the slum test, right. Next, we move to the common injury, right. For the common injury for this slum test is the lumbar radiculopathy, which is at your back, right? This test for your back. Okay, that is the common injury. Okay, next we move to the mechanism of the injuries. Okay, what is the mechanism of this injury? Okay, the first point is the neural shaft around the sciatic nerve is being stressed or stretches as the patient changes position. Alright. Okay, next is the patient may experience stretching, okay, same, or other neurological sensation in the area of adhesion. Okay, another use for the test is detecting lumbar disorientation, okay, with the flat lumbar spine and hip completely simultaneously, alright, with the extended. The sciatic nerve and its respective nerve roots are put on tension to detect potential or a disorientation. Okay, next we move to the procedure of the slum test. Right, the first step is ask the patient to fold the hands behind the back, which is ask your patient to make take the hand, okay, behind their back. Alright, and gently apply over pressure the shoulder with one arm and bring chin to the chest, and gently apply over pressure. Alright, put on the patient's shoulder with one arm only and bring the patient chest, bring the patient chin, okay, to the chest. Must touch the chin, must touch the chest, right? So the last step is then ask the patient to extend the knee on the affected side while maintaining the position. Okay, while maintaining the position, okay, ask the patient to extend the knee, which one is the effective side, right or left, right? Okay, extend the knee, and while must maintaining the position, alright, cannot move. Alright, next, the last one is the do and don't. Okay, what is do? Okay, must in the correct position. Okay, the patient must be in the correct position. Alright, the next is must sit properly. Okay, that's for do. And for don't, patient cannot lay down on the floor while the task begin, and patient cannot move while the test begin. Okay, I think that's all for me. Thank you. Alright, so the next test is the slum test. Alright, so basically slum test is for the lower limb, which is your lower body. So what you need to do is, the first step is ask the patient to fold the hands behind the back, right? Okay, like this, and then body. Right, the step 2 is gently apply over the pressure to the shoulder with one arm. Alright, to bring to one arm and bring the chin to the chest. Right, pressure like this. Okay, and the last step is then ask the patient to extend the knees on the affected side while maintaining this position. Ask the patient to extend the knee where it is affected side, right? And then do like this. Alright, so that's all for the slum test. Alright, so thank you.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Imran bin Ismail. I'm from RSR 2454A. So today I want to present about spurling test. Spurling test is about a medical maneuver used to assess nerve root. The spurling test, also known as maximal cervical compression test and foraminal compression test. It is used during musculatal assessment of the cervical spine when looking for cervical nerve root compression. The anatomy of the injury is on the nerve root. The common injury is on the neck. There are a set of mechanisms described, taking into account the direction of impact and position of the head and neck at the time of injury. The first one is compressive flexion, vertical compression, destructive flexion, compressive extension, destructive extension, and lateral flexion. So next is do and don't. For do, the patient must the body in straight position and lock the lumbar. For don't, patient cannot move while test begin. Patient cannot speak on the test begin. So next is the procedure to do the spurling test. Step 1. Patient sit on the chair with the body straight, lock the back and face forward. Step 2. Turn the patient head on the affected side while extending. Step 3. Apply a downward pressure on top of the patient head. Today I want to show you guys how to do a spurling test.
My name is Norsyafiqah, so I will explain about the cervical distraction test. The anatomy of cervical distraction test. This test is to detect the presence of radiculopathy in the symptomatic limb caused by cervical nerve root compression. The result of this test, if the pain is released as the result of the movement, then the test is positive for the nerve root compression and facet joint pressure. One injury is the cervical radiculopathy, neck pain, pain in arm unspecified. The mechanism of injury is nerve in the neck is compressed or irritated where it branches away from the spinal cord. Pain that radiated into the shoulder and or arm and muscle weakness and numbness. The procedure of the test asks the patient to supine lie where the neck is comfortably positioned. The examiner should securely grasp the patient, place hand firmly at the occipital area and around the mastoid process while standing at the patient head. Slightly flex the patient neck and pull the head toward examiner body. Apply the distraction force. A positive test is the reduction or elimination symptom with traction. Do and don'ts during this test is do lying with comfortable position and neck in relax. Placing the hand in correct step and position on the patient neck. Don'ts is do not relaxing the muscle of the neck. Improper placing of hand by the examiner. Improper position of the examiner. Ask the patient to supine lying and neck comfortably. Examiner securely grasps the patient, place hand firmly at the occipital area and around the mastoid process while standing at the patient head. Slightly flex the neck patient and pull the head toward examiner body, applying a distraction force. A positive test is the reduction or elimination of symptom with traction.
Assalamualaikum. My name is Siti Norsyafiqah binti Ismail. The special test that I perform is Chem Test. Chem Test, or other name, is Lumbar Quadrant Test. This test is used to assess lumbar facet joint pain. Usually for those who have this pain, often feel pain at their lower back pain at a certain level, mostly L4 until L5 or L5 until S1. This can be caused by falling, heavy lifting and sport injury. So this test can be performed in seated or standing. I will show you how to do Chem Test in standing position. First step, the patient is standing in extending the spine maximally by holding their shoulders. Step 2, the patient should rotate and lateral flex to the side of pain. The test is positive when the patient reports pain, numbness, or tingling in the area of the back or lower extremities. The pain is located on the side of being tested.
Hi and Assalamualaikum to my friends and also Sir Dzulkarnain, my lecturer. So I want to share about the faber test for spine injury. So the table of content is anatomy of injury, common injury, mechanism of injury, procedure of test, and also do and don'ts. Okay, so for the anatomy of injury, the sacroiliac joint is a connection to hip bones to the sacrum and the triangle bone between the lumbar spine and coccyx. So the second one is the primary function of the sacroiliac joint is to absorb a shock between upper body of the pelvis and also leg. And then the muscle that support the sacroiliac joint function include gluteus maximus. Okay, so for the common of injury for the sacroiliac joint dysfunction is from fall, car accidents, pregnancy and childhood, and then hip or spine injury, and also work injury. Okay, so for the mechanism of these injuries is a dysfunction is it's called a SI joint. Sometimes it causes from a lower back and leg pain. So sacroiliac joint dysfunction may causes inflammations from an infection and also rheumatoid conditions. Then it can also produce a pelvic pain and also stiffness. Okay, so for the positive and negative sign, the positive is positive test is one that the reproduce the patient's pain or limit their range of movement, and the negative side is a patient can perform full of motion without limitation of the movement. Okay, so for the procedure, first the patient in supine positions, and then you are going to be flexing and abducting their hip by placing their leg into figure 4 positions like this. Okay, so then going to place your hand to stabilize the pelvis, and another hand let me drop down as far as they can. Okay, so do the test to unaffected side first.
Explain about the femoral nerve tension test. The anatomy of femoral nerve tension test, it also known as the femoral nerve stretch test. This test is to screen for sensitivity to stretch soft tissue at the dorsal aspect of the leg, possibly related to the nerve root impingement. The femoral nerve lies with scapula triangular, and it is bounded by the inguinal ligament superiorly, the medial border of the sartorius muscle, and the lateral border of the abdominal longus muscles is the area of the femoral nerve. The common injury that occur is this herniation affected the L2, L3, and L4 nerve root at the lumbar, quadricep problem, lower back pain, possible femoral nerve compressions. Mechanism of the injury is penetrating trauma to the thigh, injury by stab, gunshot wound, or the pelvic fracture. The procedure of this femoral nerve tension test is: firstly, ask the patient to prone lying on the examination table. The examiner stabilizes the ipsilateral pelvis with one hand to prevent movement. The other hand flex the knee as much as possible and hold the maximal flexion position for 45 seconds. Positive test is reproduction of the patient's symptom. Be sure to compare to unaffected limb. The result of the test range of 80 to 100 degrees of knee flexion. Positive for unilateral pain is produced in lumbar region, buttock, posterior thigh in the combination of this region. The dura tension between 80 to 100 degrees is positive. The range it could be indicate the disc herniation that affect the L lumbar 2, 3, and 4 nerve root. If the produce pain before 80 degrees of knee flexion, positive for the quadricep tightness or injury. It is important to perform the test on both sides to compare the symptom. Do and don'ts for this test is stabilize ipsilateral of the pelvic and the test area. Compare for both leg, affected and unaffected leg. Don'ts is do not force knee flexion if patient complain of sharp or shooting pain. The patient is prone-lying on the examination table. The examiner prepare for the test. And then the examiner stabilize the pelvis with the one hand to prevent the movement. And then flex the knee as much as possible to hold the flexion position for 45 seconds. And be sure to compare the unaffected leg.